Head Injuries by Enrique Alvarez, Madeline Duncan, Alexis Gonzalez, and Leslie Salazar. A head injury can range from a minor bump on the head to a serious brain injury. It's usually classified into two different categories, open and closed. An open head injury occurs when someone receives an impact hard enough that the skull is fractured and the object enters the brain, or when there is damage to the scalp. They are typically caused by high-speed traffic accidents or a gunshot to the head. A closed head injury occurs from receiving a hard impact to the head. The object does not break the skull. They are typically the result of a fall, playing sports, accidents at work, or an accident at home. The impact can result in a concussion, or depending on how hard the blow was, a subdural or extradural hematoma. A concussion can be considered a traumatic brain injury. Some common signs that a patient may be suffering from one include headaches, changes in alertness, loss of consciousness, memory loss, or changes in thinking. A subdural hematoma is when there is a collection of blood in the dura mater and the surface of the brain. It can be considered one of the deadliest of head injuries. An extradural hematoma is when the bleeding occurs between the inside of the skull and the dura mater. It is often seen in young people because the membrane is not as closely attached to the skull as it is in older people or in children younger than 2.
There are 4 levels of consciousness: least severe, more seriously injured, even more seriously injured, and the most serious condition. A patient who is alert and conscious has the least severe type of head injury. They are most likely to respond to stimuli and respond fully to questions. A patient who is drowsy, can be awakened by loud voices and gentle stimuli, are classified as having a more serious injury. A patient who is even more seriously injured is unconscious and will only respond to painful stimuli. They can react to stimuli including pinpricks or pinches, but will most likely not respond to verbal stimuli. A patient who is comatose and does not respond to most types of stimuli has the most serious condition.
A technologist should always assess a patient who has had a head injury before starting any examination. This starts the first time a technologist meets the patient to know any deterioration from one level of consciousness to another. A technologist can see if a patient has changed levels of consciousness by looking out for these 4 symptoms. Lethargy is when a patient is in a state of weariness that involves diminished energy, mental capacity, or motivation. Checking a patient's pulse rate every so often is important to make sure they are not crashing on us. Adults usually have a resting heart rate of 60 to 100 beats per minute. If the technologist notices the patient's heart rate is less than 60 beats per minute, this can cause the brain and other organs to become oxygen deprived. Symptoms that can lead to deterioration from a low heart rate can be fainting, dizziness, and fatigue. Another way to keep track of the patient's health status is by checking the respiratory rate. A normal adult takes 16 to 20 breaths per minute. If a patient's respiratory rate is low for too long, it can cause complications such as low blood oxygen, acidosis, or respiratory failure. Irritability can also be a sign of deterioration. Paying close attention to any behavioral differences, slurred speech, or any unusual behavior is important to note.
When sudden changes and symptoms indicative of head trauma occur, the technologist should never leave the patient unattended because the patient's condition may change at any moment. The technologist should make eye contact, provide comfort and reassurance, as well as listening to the rate and manner of speech to determine changes in the status of the patient. It is the responsibility of the technologist to recognize any signs of decline or stress and report any changes in the status of the patient's condition to the attending physician. The technologist should also assume a spinal injury with a head trauma until it is ruled out by the physician. As a result, proper immobilization and support should be provided to minimize risk of motion and to increase patient comfort. If the patient revives with an immobilization device, the technologist should never remove it without a physician's order.
Head injuries can be prevented by wearing a seatbelt, not driving under the influence, not texting and driving, wearing a helmet, preventing falls at home, and preventing falls in children. A seatbelt should be worn every time you are riding or driving in a motor vehicle. Driving under the influence can involve drugs, including prescription medications or alcohol that have the ability to impair a person's driving. The number one driver distraction is being on their cell phone. When using a phone while driving, it is similar to having a blood alcohol level of 0.08. A helmet should be worn when taking part in recreational activities or sports. Examples include softball, baseball, football, and riding a bike, skateboard, or motorcycle. Falls can be prevented by removing clutter and throw rugs, having a non-slip mat on the shower floor, and getting routine eye exams. Preventing head injuries in children consists of having a safety gate at the top or bottom of the stairs, making sure there is no clutter on the stairs, and having window guards to prevent falls out of open windows.